This program is brought to you by Express Employment Professionals, respecting people, impacting business, located in Durango, serving the Four Corners area.
San Juan public health officials warn that summer is the time when deadly viruses and bacteria in the form of West Nile disease, rabies, and bubonic plague are most likely to infect human populations. And they want you to take precautions to protect yourself and your family. One of the most prevalent diseases that lurks in the area is the West Nile virus. In Colorado, it's been detected in Weld and Larimer counties on the Front Range and in Delta County on the West Slope. Although area testing so far hasn't found West Nile in local mosquito populations, it's bound to show up now that the summer rains have started.
We are always going to host West Nile here in this Four Corners area because we have that Gamble's oak, pinyon, juniper, brush, scrub country, and that's prime habitat for the corvids, which are the crows, magpies, and jays. And they're the highest viral count carriers of any organism on the planet. So when West Nile made it to Colorado, got into our bird population, we're constantly hosting it here. So the key is keep the mosquito population close to zero so they can't pick it up from the birds and take it to you.
Kiefler knows firsthand what it's like to contract West Nile. He was working as a field technician for the Animas Mosquito District, clearing brush in the Animas Valley in the fall of 2012. He detected no mosquitoes in the area, so he wasn't wearing any repellent. It turned out to be a mistake. He developed a debilitating headache, body aches, and fever.
After 3 weeks of that, I had nothing left. I didn't care if I lived or died. I've never been in that place in my life where I was rendered down to that condition.
Kiefler wound up with heart damage and arthritis that has left him weakened. Although the Mosquito District has significantly lowered the mosquito populations with its organic programs to destroy mosquitoes in their larval stage, homeowners need to do their part.
For the house owner, property owner, keep your containers dumped out because the species of mosquitoes that reproduce in small containers that are filling with the rainfall right now are the worst transmitters of disease. And they're weak flyers, so they stay in your yard. You produce them, they stay in your yard, and they're the greatest transmitter of West Nile. So if the property owner will do their part, we do our part, we're going to win this game.
Other dangers lurk on the ground. According to San Juan Basin public health officials, incidents of rabies and bubonic plague are on the rise in animal populations in southwest Colorado, and they caution residents to avoid contact with wild animals and to treat their pets with flea deterrent and rabies vaccines. The biggest source of rabies in the areas are bats and skunks. If you have a bat in your home, get rid of it immediately and have yourself tested for rabies. Bat teeth are so small that you can't detect whether a bite has occurred, especially when you're asleep. Health officials also have noted a rise in rabies cases in local skunk populations.
Now that we're seeing these huge increases in skunk rabies is making sure that you are not attracting skunks or other wildlife to your home. So we recommend no feeding animals outside, really talking to your kids about not playing with wild animals, not being aware if your pets are bringing them into the house. If your cat or dog is dragging something into the house, then that's something you're going to want to investigate.
Plague is carried by fleas that live on animals like rock squirrels, prairie dogs, and chipmunks. Just the kind of critters that your dog or cat may like to hunt and bring into the house. If you see a die-off of squirrels or prairie dog populations in your area, contact the health department to test for the presence of plague. Don't allow your children to play or bury dead animals, and be sure to have your pets treated with flea repellent. To learn more about animal-borne diseases, visit the health department's website.